Hi there, Tracy from Kazadans Equestrian, and welcome to this week's video. If you haven't been on my channel before, then welcome. Have a look at all the videos I've got. If you like what you see, please subscribe to the channel. Share any of my videos around that you think might be useful, and don't forget to click that notification bell. And all that does is let you know every week, mostly, when I release a video. This week I'm continuing on with the lameness series, and we're going to have a look at some of the external factors that can influence the lameness and how we can use these to help identify potential causes. So the first thing I'm going to look at here is temperature. Obviously, sometimes we have problems with our horses, which means that they warm out of a lameness or a stiffness. So ideally, we gauge the horse's lameness at a cold temperature. So straight out of a stable, straight out of a stall or a yard, even out of a paddock, they can maybe have done enough exercise to warm themselves up. But if you want an accurate gauge, we gauge from the cold horse. As the horse warms up, obviously the blood flow is increased, there's more tissue activity, and sometimes this can either exacerbate the pain for the horse, sometimes it can minimize it. So we definitely get a better judgment when the horse is cold to start with. If your horse is a horse that when you first get on feels stiff, slightly asymmetrical, but warms out of it, it is likely now that you're looking at a joint issue. This occurs more commonly with arthritic problems, so that's a really good place to start, having a look at some joint supplements, narrowing it down to particular joints so that you can discuss options here with your vet. Sometimes, however, your horse gets worse the more you exercise, and this is when the blood flow and activity increases the pain level. This is more likely to be a tendon ligament problem. This is not definitive because sometimes the increase in the blood flow can reduce the pain as well. It's a bit tricky, but in general, if you think about the fact that if the horse warms out of it, it's joint and stiffness and maybe arthritis. If the horse gets exacerbated or the asymmetry or the lameness is more obvious after working, it's more likely to be a ligament or tendon issue. But you can't rule out that ligament and tendon issue if that's not the case as well. But if you're getting swelling after your ride, so you've ridden your horse, they're slowly getting more and more sore, you get the horse out later in the day or the next day and there's swelling evident in that area, it is quite likely to be a tendon or ligament issue. Now, remembering these things are really important to get on top of. One of the things we must remember is the horse is a prey animal. As a prey animal, they are wired to hide the fact that they're lame because it makes it more obvious to their predators that they're a weak link. So they're going to hide it. If you as a rider feel your horse getting slightly worse and you see any swellings after, it really is time to investigate. Sometimes too we get a bit of a delayed effect. So if you're doing an exercise session, one thing to try maybe is to halfway through your exercise session, just stop for 5 minutes. Stop exercising and then restart. Quite often that can aggravate something enough to make a lameness obvious. And if this does occur, again, we're probably looking at tendon or ligament problems here, and we really want to get onto those very quickly. The other thing that can be indicated when you do that stopping exercise and starting again can actually be some pain in the coffin bone. So again, this stuff's really important to try so that you can get to your vet and get some diagnoses and treatments going as soon as possible. The other external factor, I guess, is day-to-day or longevity of lameness. Sometimes if a horse is sore or has problems down its midline, particularly around its back in that close core area, they won't show the same lameness every day. So it becomes very, very important to monitor this. Otherwise, what you get is you look at the horse and they look symmetrically stiff, or they maybe look like they're bracing. They don't look overtly asymmetric. So what you need to do here is make sure that we don't make a judgment on one assessment. but have a look for day-to-day changes in that horse. One of the other ways to add an external force to help you, I guess, try and narrow down the reason for the lameness is the footing, where you are on hard surface, soft surface, etc. So obviously when you're on a hard surface, this increases the concussive forces. If when you work your horse on a firm or hard surface and the lameness becomes more apparent rather than less apparent, you're likely to be looking at lower limb problems. So if trotting out the horse on the concrete or the bitumen makes it worse, you're possibly looking at foot lower limb. Now, quite often you take that same horse onto a soft surface and they don't show the asymmetry or the lameness anywhere near as much. So sometimes the soft surface supports that. And the soft surface usually helps if it's a weight-bearing lameness. There are some exceptions to that. And these are the ligaments and parts of the horse's hoof that need to get more tension put on them, I guess, when the heel has to lift up out of a softer ground. So you imagine this is the danger, I guess, with going with horses into sand that's too deep. Their heel digs into the ground and it puts excessive tension onto some of the back of the very important ligaments of the horse. So if your horse is going worse in the softer ground, it could well be one of those very, very important supporting structures. So please get this checked out as soon as possible. It can also be a problem where the horse can't clear the ground quite as well. So maybe a problem in the stifle if you're seeing it in the back end of the horse. And also fetlock joint pain because of the protraction of the stride of the horse. If they can't lift it quite as much, they can sometimes find the soft surface harder to hide the lameness in. The next external factor that we can apply to give us a bit more of an idea is direction. The first thing we want to be doing here is looking at the horse move, walk and trot on a straight line. So no change in direction. Now, if a horse appears more lame in a straight line, it's quite likely to be an issue with a suspensory ligament or some fetlock joint pain. That puts more strain on these areas in the horse than it does if the horse is on a bend. So this can be a little bit indicative of that type of problem with your horse. And then we're going to circle, of course, lunging or circling your horse in a round yard. As we move the circles and as we make the horse bend, we're shifting the load and the weight bearing in the lower limbs of the horse. Sometimes this can exacerbate problems and sometimes this can make the problem better. If you're dealing with a weight-bearing lameness, when the problem limb is on the inside of the circle, it will be having to carry more weight, just in general to the lean of that horse. So if the horse is leaning, it has a weight-bearing problem, it will become exacerbated when that limb is on the inside of the circle, and you may see improvement when the limb is on the outside of the circle. Please remember, all of these are very general because it can also be whereabouts in the joint the horse is feeling the pain. So maybe they're on the inside leg, but the outside part of the fetlock joint, for example. So these are very general, but they're really quite a good guide to give you an idea. Non-weight bearing problems normally become obvious when the horses or when the troubled limb is on the outside of the circle. Why is that? Well, because on the outside of the circle, stride length becomes very important because it has to cover more ground on the outside of the circle. So as the horse is trying to do this with the affected limb, you will notice the more asymmetry there. You can also find with those types of lamenesses, then with that leg on the inside, that the problem just disappears. So the non-weight bearing problems can be, tightness in muscles, stifle problems, all of the lamenesses that are more biomechanical rather than, I guess, pain indicated. Now you've got your horse on the circle, the other thing to do is to make those circles smaller. Now this sometimes feels extremely mean. If you can already see and get a good indication, then you don't need to force the point. But if you're really trying to force one of those asymmetries to show up, then making the circle smaller can increase the load on, in particularly, the inside limb. But it can help in a couple of other ways too. For example, if you're looking at a bilateral lameness in the front, so this is both front feet are sore, or both something going on in both of the lower legs, what you will find is as the circles get smaller, the horse will tend to want to look out with his head to the outside of the circle because he's putting so much weight on the lean, the natural lean. He's trying to balance the weight. So a horse that, as the circles get smaller, desperately needs to turn its head to the outside can actually be showing you that both forelegs are causing him a problem. As you make these circles smaller, the horse obviously has to bend more and more. A horse that's having a lot of problem with its back and even neck is going to get to a point where they don't want to bend that much. So they as well change the way their body goes so that they don't bend that much. You may find that sort of horse even leaning more so that they can keep their back straighter but lean in more. Or you can even find them traveling almost like on a 3-track and facing in a little bit towards you so that they're not forcing their body to bend. And this can be an indication of something down the midline causing your horse a problem. And if you're assessing your horse under saddle or somebody else is assessing under saddle, then a figure 8 is a really good way for you to be able to see the difference between a bend one direction and the other direction. So I think that's enough for this week's video, and next week I'm going to look at other factors and other ways we can add external inputs to try and nail down where your problem is, like slope, transitions, gait changes, and even speed. Some lamenesses show up more or less. So if you're enjoying this, don't forget again, please subscribe to the channel, share the video around. Click that notification bell so you get notified when next week's video comes out. And I'll see you next week with the next continuation of this video. Thanks for listening.